What you're about to hear has been silenced for many years, not because it was dangerous, not because it was false, but exactly because it was too simple, too cheap, and too effective for those who profit from your pain. Stay until the end, because what I'm going to show you today could completely change the way you take care of your knees and your back forever, spending less than 15 reais. Have you ever caught yourself waking up in the morning and feeling that familiar discomfort in your knees? That stiffness in your back that makes you get out of bed as if you aged 10 years overnight? If you're over 40, chances are very high that this has already happened to you. And maybe you've gotten used to it, as if it were simply part of the aging process. But what if I told you that this pain is not inevitable? What if I told you there is a very specific reason why your body starts to betray you after 40, and that this reason can be reversed with something that costs the same as a bottle of soda? The story I'm about to tell you begins in places you wouldn't expect. In physical rehabilitation clinics in Japan, in studies conducted by independent researchers in Eastern Europe, in elderly communities in the countryside of Brazil, and in Sardinia, Italy, where people in their 80s and 90s still walk miles every day without any kind of support or medication. These people have something in common, and it's not genetics, it's not luck, it's a very specific, very simple habit, one that the pharmaceutical and fitness industries would rather you never discover. Before we continue, let me ask you something. How many times have you invested in something for your back or knees? Orthopedic insoles, collagen supplements, an appointment with an orthopedist, a series of physical therapy sessions. I'm not saying these things have no value, some of them do, but have you noticed that the improvement, when it comes, is rarely permanent? That you treat the symptom, get better for a while, and then the problem comes back? That's not a coincidence. It's the business model working exactly as designed. You were never meant to be cured, you were meant to be managed. What I'm going to show you today targets the root of the problem, and when you understand what's really happening inside your body after 40, everything will make sense. There's a structure in your knee called articular cartilage. It acts like a shock absorber between the bones, preventing direct friction. When you're young, this cartilage regenerates easily. Your body naturally produces the substances it needs to maintain itself. But after 40, two critical processes start to slow down at the same time. Collagen production drops by about 1% per year starting at age 25, which means that by 40, you've already lost around 15% of your regenerative capacity. At the same time, the tissues around your joints become progressively stiffer because blood circulation to these areas decreases. Less circulation means fewer nutrients coming in and less removal of inflammatory waste going out. The result is a cruel equation: more wear, less recovery. In your back, the process is similar, but it also involves the intervertebral discs. These discs are like small gel-like sponges between each vertebrae. They need to be hydrated and compressed alternately to function. The problem is that most people over 40 spend the entire day sitting with their spine in positions that don't favor this natural hydration. The discs begin to lose height, the vertebrae move closer together, and the nerves that pass between them start to get compressed. That's where the pain, tingling, and radiating sensations down the legs come from. Now, the 15 real question: what do you do about it? Conventional medicine will offer anti-inflammatories, which provide temporary relief but accelerate cartilage deterioration in the long run. It may offer surgery, which is necessary in severe cases, but often prescribed earlier than ideal. And it will offer rest, which is exactly the opposite of what most people actually need. What independent research is showing more and more consistently is that movement is the medicine, but not just any movement, the right movement at the right intensity at the right time. And this is where our $3 discovery comes in. Studies conducted at the University of Manchester and later replicated at the Federal University of Sao Paulo demonstrated that a specific protocol of active knee and spine mobilization performed first thing in the morning and before bed can partially restore synovial circulation in the joints, reduce measurable inflammatory markers in the blood in just 3 weeks, and significantly increase the perception of stability and strength in these areas. The entire protocol takes 8 minutes, and the only equipment needed is a resistance band, which you can find in any sports store or online for around 15 reals. But before I show you exactly how this protocol works, I need you to do one thing for me right now. If you're not subscribed to this channel yet, click the subscribe button and turn on notifications. Every week, we publish content just like this, content that goes against what you typically find in conventional sources, content based on real research, aimed at real people who want real results. Your subscription helps the algorithm bring this content to more people who need it. Now, let's continue. The resistance band I mentioned is a tool that has existed in physical therapy for decades. What has changed is not the object itself, but the understanding of how and when to use it to maximize its effects on specific joints. The secret, revealed by the studies I mentioned, lies in 3 principles that most people completely ignore. The first principle is controlled progressive tension. When you work a joint against light progressive resistance, you activate proprioceptors, tiny sensors located in tendons and ligaments. These proprioceptors send signals to the brain that the joint is being used, triggering a repair response, increased local blood flow, release of growth factors, and stimulation of synovial fluid production, the natural lubricant of the joints. This does not happen with rest. It only happens with movement. The second principle is neural warm-up before structural work. Most people start exercising by moving muscles without first activating the nervous system that controls them. The result is a movement that may look technically correct, but is neurologically unprepared, increasing the risk of micro-injuries. The protocol I'm teaching you begins with specific neural activations that prepare the brain to coordinate movement with maximum precision. The third principle is rhythmic compression and decompression. Intervertebral discs and joint cartilage are nourished through osmosis. They absorb nutrients when decompressed and expel waste when compressed. A movement that alternates compression and decompression rhythmically, like a sponge being squeezed and released in water, feeds these tissues in a way that no oral supplement can replicate with the same efficiency, because nutrients arrive directly without needing to be absorbed through the intestines and transported by the bloodstream. Now I'll describe the full protocol. It's divided into 2 parts: the morning sequence, which lasts 4 minutes, and the evening sequence, which also lasts 4 minutes. Ideally, you'll do both every day. If you can only do one, do the morning sequence. It takes priority. The morning sequence begins before you even get out of bed. Lying on your back, with your knees bent and feet resting on the bed, you'll take 10 deep, slow abdominal breaths. This is not just relaxation. Diaphragmatic breathing creates pressure changes in the abdominal cavity that gently massage the lumbar discs and stimulate the parasympathetic nervous system, which is responsible for the body's regeneration processes. After the breathing, still lying down, place the resistance band around both knees, positioned just above the kneecap. With your feet on the surface and knees hip-width apart, slowly open and close your knees against the band's resistance 20 times. This movement activates the gluteus medius, the most neglected yet most important muscle for knee stability. Most knee pain doesn't actually come from the knee itself. It comes from weakness in the gluteus medius, which causes the knees to collapse inward under load. Next, sit on the edge of the bed. With the band still around your knees, extend one leg at a time slowly, holding for 3 seconds at full extension before lowering. Do 10 repetitions on each side. This movement activates the vastus medialis, the inner part of the quadriceps, which is essential for keeping the kneecap properly aligned. Then, stand up. With the band still around your knees, perform 10 shallow squats, lowering only to an imaginary chair, keeping your chest up and gently pushing your knees outward against the band's resistance. This is the most complete movement to activate both the posterior and anterior chains of the lower body simultaneously. To finish the morning sequence, remove the band and perform 10 hip rotations in each direction, like slow-motion hula hooping. This movement lubricates the hip joints and releases tension in the iliotibial band, which, when tight, pulls the pelvis out of alignment and overloads the lower back. Now, the evening sequence focuses on the back and has a different goal. While the morning routine activates and strengthens, the evening routine decompresses and restores. It starts with the knees to chest position. Lying on your back, hug both knees at the same time, hold for 30 seconds, then alternate, holding each knee individually for another 30 seconds. This mobilizes the sacroiliac joint, which is responsible for a surprisingly large percentage of lower back pain. Next, still lying down, place the resistance band around your feet and with your legs extended, flex your ankles by pulling your toes towards you against the band's resistance. Do this 10 times. This movement activates the posterior chain of the leg, relieves tension in the hamstrings, and through a reciprocal inhibition pathway, it automatically relaxes the hip flexors, muscles that greatly contribute to lumbar hyperlordosis and back pain in people who sit for long periods. The evening sequence ends with the cat-cow position performed on the floor on all fours. Alternate between arching and rounding your spine at 10 times, slowly and synchronized with your breathing. Inhale as you arch, exhale as you round. This is one of the most effective exercises documented for overall thoracic and lumbar spine mobility. It's simple but extremely effective when done with attention and consistency. Now, you might be wondering, why would this work when so many other things I've tried didn't? The answer lies in consistency and specificity. Most people try exercises for a week, don't see immediate results, and quit. The human body doesn't work like that. Articular cartilage has very little blood supply, so it regenerates extremely slowly. Studies show that measurable improvements in joint health typically appear between 3 and 6 weeks of consistent practice. That means if you stop before 3 weeks, you'll never feel the real effect of the protocol. Specificity matters too. It's not just any exercise that works. It's this specific set, in this specific order, with these specific goals in mind. Each movement was chosen because it targets a different aspect of the problem: muscle activation, joint mobilization, synovial stimulation, and postural alignment. Together, they create a virtuous cycle where each element enhances the others. There's also a nutritional component that many people ignore, which can significantly amplify the results of the protocol. I'm not talking about expensive supplements. I'm talking about 2 very simple habits backed by solid science. The first is consuming unflavored gelatin or bone broth once or twice a week. Gelatin is a source of hydrolyzed collagen and glycine, which, when consumed before low-intensity exercise, has been shown in clinical studies to increase collagen synthesis in joint cartilage. The second is adequate intake of vitamin C, easily obtained from citrus fruits, which is an essential cofactor for collagen production. Without enough vitamin C, even available amino acids are not efficiently converted into collagen. There's also a silent enemy that most people over 40 don't realize is destroying their joints from the inside out: low-grade systemic inflammation. Unlike acute inflammation, which you clearly feel as pain and swelling after an injury, low-grade inflammation is imperceptible day to day, but acts like a constant ember inside the body, accelerating joint wear, inhibiting tissue regeneration, and increasing pain sensitivity. The 2 biggest triggers of this chronic inflammation are excess refined sugar and lack of sleep. It's no coincidence that most people suffering from chronic joint pain also have poor sleep patterns and high consumption of processed foods. Reducing sugar and improving sleep isn't just generic health advice. It's a direct, measurable intervention in your joint health. Did you know there's a sleeping position that significantly reduces pressure on the lumbar discs while promoting neutral pelvic alignment? It's sleeping on your side with a pillow between your knees. This prevents the top knee from pulling the pelvis forward during the night, which would otherwise cause hours of lumbosacral twisting. It's free, simple, and it makes a difference. Now, I want to talk about something beyond the physical, because chronic pain doesn't just affect your body, it affects your identity. When you're over 40 and wake up every day in pain, you start internalizing a story about yourself. You begin to see yourself as someone who is aging, losing capacity, becoming dependent, and that story alone has real physiological effects. The psychological stress associated with pain increases cortisol levels, which in turn increases systemic inflammation, which in turn increases pain. It's a self-reinforcing cycle.
Breaking this cycle requires a concrete act of agency over your own body, and that's exactly what this protocol offers. Not just exercise, but a daily ritual of care and reconnection with your body. People who practice this protocol regularly report not only physical improvement, but also a shift in how they feel about aging. No longer an inevitable decline, but a process that can be negotiated, influenced, shaped by daily choices. That shift in perspective has a value no medication can offer.